So post-operative instructions, what is important? The first 2 days are the most important, and please pay attention to the instructions here. What is normal to happen? It's normal, totally normal to have some bleeding in the first 2 days. So if you have bleeding, please, we gave you a gauze, some gauze, or you may have gauze at home. You need to bite a gauze for 30 minutes in the area of the wound. You need to feel the pressure in that area, okay? And if and then you need to keep the gauze there for 30 minutes. If you take it out with 5 minutes and then it continues bleeding, you need to do it again for 30 minutes again. So in case of bleeding, use a gauze and bite for 30 minutes. Okay, it's totally normal to feel to have a little bit of taste of blood in your saliva. Swelling, it's totally normal to have some swelling, especially for more complex surgeries. Okay, some people may swell more than the others. All right, so to prevent any swelling, please use a pack of ice. The ice pack you need to use 20 minutes on, 10 minutes off. 20 minutes on, 10 minutes off. The more you do, the better for the initial 2 days. Just in the first 2 days. After that, you don't need to use the ice anymore. Okay, your meals in the first 2 days, they must be cold for the same reason, because we don't want to have any heat in your mouth, because the heat promotes bleeding. Okay, and if it bleeds, then you need to take your measures that I just explained. And your meals should be soft and cold. Please avoid nuts. Nuts may get stuck in the wound, especially if it's a lower tooth, and that can cause pain and infection as well. Pain is another thing that is totally normal in the first days of a surgery. So we prescribe the medication for you. Please take the medication as prescribed. And if the normal medication, which is Panadol and ibuprofen, if it's not working for you, if you still are in considerable pain, please let me know, and then we can change the medication for you. Sometimes in lower molars, when we take out the tooth, even if you're following all the instructions, you may have pain. Actually, pain is normal. Pain is normal for any sort of surgery in the first days. But if you're having constant pain after 4 or 5 days in the lower molar, maybe you may have some rest of food getting stuck there. So what you need to do is flush away every time that you after your meals. You need to flush away that rest of food that gets stuck in the socket. How to do that? You need to use a syringe with a plastic tip. You just put, let's say that this is the hole of the socket. You don't need to go inside. You just put it close and rinse with warm salt water. Could be a cup of water, just half a teaspoon of salt. Rinse, shake, and then you can use to rinse that area. Could be chlorhexidine. Savacol is another option to use to rinse the socket. Something that is unusual to happen, but it may happen, is dry socket. Dry socket is pain, a persistent pain. It's that you may have even after a week of the surgery. Usually, we normally see pain in the first 2 days, and then this pain wears off. Normally, this is what we expect for a normal surgery. But if your pain after the 4th day is still getting worse and worse, you could have one of the two problems. One could be an infection. The other one could be dry socket. Dry socket is more a problem with the healing of the socket. Dry socket is not an infection. It's the socket, the blood clot, because of the blood clot that should be resting into the socket. It's for some reason it's it disappears, and then you have an exposed bone. And this exposed bone becomes, it's quite painful, and until we have all the cells coming from the gum and closing that area, that process takes about 2 weeks. And during this phase, you still have pain, and some patients, they mention that it's really painful. Okay, this is something that may happen, and especially for patients that are smokers, this is more prevalent with smokers. By the way, smoking, please, smokers, if you smoke, please avoid smoking for at least 1 week. Okay, to prevent dry socket and to promote a better healing for this traction area. Something that is very unusual to happen is bruising. Bruising is more related to bone graft, and when we have to open a flap, open the gum to do a more extensive surgery. If you have a bruise, don't worry, it usually wears off by itself in a matter of days, 4 or 5 days it wears off. So to conclude, please pay attention in the first 2 days. Your meals should be cold. You need to eat cold and soft in the first 2 days, and then slowly you go back to your normal meals. Please keep your fingers and your tongue away from the area that we did the surgery to prevent any problem. Take the medication that we prescribed. This is very, very important. Don't take a rest. Don't leave the surgery and go for a walk, or go to the gym. This is going to cause you pain. It's normal to have bleeding. It's normal to have pain. You did a surgery, so just take a rest. The better you do your resting period in your first days of resting, it's you're gonna have a better outcome from the surgery. We usually do the suture removal after between 1 and 2 weeks, depending on the complexity of the surgery. But I can see you anytime. If you have any issue, please call our clinic, and I'd like to see you. Me or one of our dentists is going to see you. Okay, and thank you very much.